Welcome everyone to our weekly Q&A session with Toronto's Associate Medical Officer of Health, Dr. Vinita Dubey. Thank you so much for joining us again today.
Of course, thanks for having me.
Absolutely. My name is Dilshad Burman. I'm a writer and reporter with City and 680 News, and I will be moderating this chat today. Now, the way it goes is we've been collecting your questions over the past week for the doctor, and we will present them to her today. She's never seen them before. This is all off the cuff. And if you haven't had a chance to submit your questions yet, whether it's on our website or through our social pages, you can still do so in this live chat next to this YouTube broadcast on the side. And we'll try to get to as many of the questions as we can in this short half-hour period that we have with the doctor. So we're going to get started right now with the cache of questions that we've collected. We're going to start with a few vaccine questions and then move on to the other questions because people have lots on their mind this week. So doctor, are you ready to go?
Yeah, let's go.
All right, let's get started here. Let's start with Wings. Wings is a regular contributor to our Q&As. They ask, since Vaxzevria is unapproved in the US, what shall we do when there is a pending when we have pending US travel plans? Do we need to get revaccinated with the approved FDA vaccines?
So right now, the US does not have a vaccine requirement for entering their country. I don't believe that's changed in the past week. You actually don't have to show proof of vaccination. So that's, I think, the important thing. I think you're going to have to, if it's a specific cruise you're going on or a specific resort or location that you're going to, you're going to have to find out what their vaccination policy is, right, because certainly businesses can choose to adopt their own policies.
Right. Okay. And we actually have some live questions coming in already. So let's go into this one. DMK asks, how many school kids 5 to 12 years old suffered from severe COVID-19 effects with no additional comorbidities in Ontario?
Well, actually, I don't think the question should be in Ontario, because I think right now we've actually done a good job of keeping COVID under control. I mean, that's what the modeling from and the update from the science table this week showed us, is that our numbers have plateaued. And it's a different story, though, in other parts of the province. In a place like Alberta, there are a lot of pediatric cases, including some who have gotten very sick. Right. And I think looking at the US, where they have had a lot of pediatric infections, some, including healthy people, have gotten very sick. Mm-hmm. And so I think we're really understanding the Delta variant and how it can make people sick, including healthy children. I think it's important to understand this distinction, though, between healthy and children who have a health condition. I don't think that that's a fair distinction always. A child who has asthma, is that a health condition? What about a child who gets ear infections or migraines? Like, some health conditions in children can otherwise make the child actually quite healthy. And so any type of COVID infection that makes children sick and very sick, including the Delta variant, we need to keep a close eye on. So while the numbers are still small, especially in Ontario, the risk is still there. I think, sorry, just to add one more piece, is long COVID. We're still understanding about long COVID in adults and in children. And what we know in adults is that even an adult who had very few symptoms of COVID, 1 year later can still have symptoms of long COVID. And that is certainly something that we need to keep a very close eye on for children as well.
Right. So, doctor, you were mentioning even if an adult has very few symptoms, they seem to have long COVID symptoms a year later. Does the severity of the infection sort of contribute to that long COVID? Have we made that connection yet?
Well, that's the thing. It's not always based on the severe illness. Like, I think if you were severely hospitalized, you could have a cough that could last for a long time. Like, you would have damage to your organs. Those symptoms could last for longer. Right. But actually, it's been shown that even people who have mild illness from COVID may still complain of fatigue or that brain fog, even up to 12 months afterwards. Wow. That was actually an update in the science table update this week to say if we get long COVID, it will actually drain our healthcare system as well.
Right, absolutely, because people are going to get sicker for longer, essentially, and it's just going to be that much more of a strain, for sure. Okay, let's move on to the rest of our cash questions here. John asks, if the vaccines don't provide immunity or prevent transmission, why should I be taking it? I don't need it if it doesn't protect me.
Actually, it does protect you, John, and it provides immunity. The goal of the vaccination is to prevent you from getting very sick, hospitalized, and dying. And we've shown in Ontario that the vaccines work very, very good, upwards of 90% against severe illness and hospitalizations and death. And so it gives you immunity that way. We do know that if you're vaccinated, you can still get COVID. It is less likely, 5 or 7 times less likely compared to an unvaccinated person. And if you get COVID, though, it is a milder illness. And so that's why even if you're vaccinated, we still want you to wear a mask and keep those precautions in place.
Right. Okay, let's go to some live questions coming in on YouTube. Sheila asks, why is our government not accepting Sinovac vaccine to enter Canada? The WHO has approved it. Can we as Canadians come back if this is the only vaccine that was offered to us? I'm guessing outside the country.
Okay, so the requirements that you're talking about are actually based on the Federal Quarantine Act. And so there's no obligation that everyone be vaccinated to enter Canada. But if you have a Health Canada approved full vaccination series, then you have some exemptions for the self-isolation.
Right.
And you might just have to do testing, but don't have to isolate for 14 days. If you are vaccinated with non-Health Canada approved vaccines and returned from travel, you will have to isolate. And that's based on federal requirements.
Right. So it's not that you're not being let into the country, it's you're being let into the country, but you still have to take that 14 days of quarantine so that we can make sure that you don't get symptoms and are not carrying COVID, right?
That's right. And I want to be able to make this distinction, though, that for Ontario, our vaccine certification program, like to go to an indoor dining place, if you were vaccinated with Sinopharm and meet the definition, so there is a definition for being fully vaccinated. If you received a vaccine that was not given in Canada, then you could still qualify for that certification process.
Right. And doctor, you've mentioned before, people just have to register with public health, right? They have to let public health know that I got this vaccine, and then they're put into the sorry, I forget the name of the system. COVAX, is it?
Yes. Yeah, so we have some more information that, yes, you can notify public health to get your out of province record documented into COVAX, our provincial vaccine registry, but you can actually also use your proof of vaccination from your other country here. And so in some cases, if you got 2 doses from another country, you need a 3rd dose of a messenger RNA here. In some cases, if you got 3 doses from another country, that would be considered fully vaccinated. So you'll have to look up the definition for fully vaccinated from the province.
Right.
But even that record, if you got 2 Pfizer in a country outside Canada, that record from the other country still holds for this vaccine certification process.
Okay, that's good to hear, because I think then in Ontario especially, we have a lot of people coming in from out of country, and that makes sense for them to be able to then access various facilities for sure. Okay, let's move on to Dallas's question. Dallas asks, with the new requirement of providing proof of vaccine taking into effect, the way I understand it is that patrons in restaurants, gyms, etc., must provide their vaccine proof. However, the same facilities, especially restaurants, are not requiring their staff to adhere to the same guidelines. So if the staff doesn't have to get vaccinated, but the patrons do, how is that protecting anybody?
Okay, so it's a good question. So the vaccine certification process is for patrons. Staff are covered under occupational health and safety guidelines, regulations, recommendations.
Okay.
And in Toronto, we have made a recommendation that workplaces have a vaccination policy for their staff. So while it's not a requirement under the vaccine certification process, it is certainly recommended that restaurants have a policy for their staff. It is in the best interest of the restaurant to look after their staff, because we know that in restaurants among staff, there have been outbreaks. And if their staff are not vaccinated, they will not even be able to protect themselves from an occupational health and safety perspective. So that is still a public health recommendation. But you're right, it is not included in the vaccine certification process, that regulation.
Right. It's under another set of regulations, essentially.
Well, there is no regulation requiring it of employers, but there is a strong recommendation. Yes.
Right. Okay.
But in some workplaces, it is a requirement. And so that's why you have to follow up with your particular workplace. But on that,
Right. Absolutely. And doctor, as we've talked about before, private businesses honestly can mandate that for their employees if they need to or if they want to.
That's right. And so, if you're asking about a restaurant, you could ask them, do you have a vaccination policy for your staff?
Yeah, absolutely. Okay, and then let's go to some live questions from YouTube. David asks, what is the government's view on natural immunity after an infection?
So if you have had a recent COVID-19 infection in the last 90 days, were cleared by public health, then if you were exposed to someone who had COVID within those 90 days, like were a close contact, as long as you don't have symptoms, you do not need to self-isolate. So it has been taken into account in certain circumstances.
Right, absolutely. And as we spoke about last week, doctor, I think a lot of people asked why it's not being included in the vaccine passport and it's and you mentioned that it's being taken into account in these situations. Is there any sort of talk or any leeway in terms of taking it into account in the vaccine passport?
Well, see, people who have had a recent COVID-19 infection are still recommended to get vaccinated. So I think that that's an important point. The vaccine is still safe and it will give you better protection as well.
Right. Okay. And let's go back to another question on YouTube. With the vaccine passports coming out, how are you going to make it easily accessible to seniors? If it's a digital one on smartphones, it'll be hard for seniors to use.
Yeah, good point. My understanding is that even when the QR code system comes into effect in October, the paper receipts that we're using now can still be used. Okay. So I think that's important to know, that seniors can continue to, or non-seniors as well too, can continue to use that paper-based system with the receipt with ID.
Right, absolutely, because it has to be accessible to people that don't have smartphones, for sure. Okay, let's go back to the submitted questions. Mike asks, how will having a mixed vaccine of AstraZeneca and Moderna affect my travel plans to the US? Actually, we just spoke about this, doctor.
Yeah, it shouldn't affect your travel plans to the US. And I do think it's important to know that a mixed schedule of AstraZeneca with one messenger RNA vaccine actually has been shown to give you that better protection as well.
Okay, wonderful. This is very sweet. I have to read this out because this is rare for us. TY says, not a question, just some gratitude for this forum where people can ask everyday questions and get their queries addressed. Thank you so much for that, TY. That's very kind of you. And thank you.
No, thank you for that. Yeah, I want to say that the questions are always so good. I mean, honestly, people have really important questions. It's changing week by week, and so really happy to be able to answer what we can.
Yes, absolutely. Thank you for that. You brought a tear to my eye. Okay, let's go to Robert. Robert asks, why is it that even after the second shot, which scientists say gives us full immunity, social distancing, masks, and other protocols are still considered necessary, and we're reluctant to reopen the economy? I'm sure a significant threshold of vaccinations has been achieved to allow some form of normalcy now.
Well, I think our economy is pretty open now, actually. It's just open with some restrictions, right? And I think the reason for the restrictions now is because we still have COVID circulating. And we know that if we don't keep the restrictions up and only rely on vaccinations, we could be in a place where we have accelerated growth. And we're in the fourth wave right now. Now, when we're out of the fourth wave, we can reassess those other restrictions that are in place. I think when we talk about the vaccine certification process, the passport, that is actually a way to keep businesses open, actually, despite being in the fourth wave.
Yeah, absolutely. And you're right. I feel like it's almost scary how much has opened now. I took my first indoor yoga class the other day. It's a big deal. It's a big deal compared to last year. We do have a lot more going on this summer, fall, I think.
That's right.
Yeah, for sure. Okay, let's move on to Sarah's question. Sarah says, I am fully vaccinated, but I'm getting confused. What is the point of providing a vaccine certificate for non-essential businesses if unvaxxed parents and guardians can send their kids to school? We can shop or bank with people who are unvaccinated. They say that they are an essential worker and have been working beside unvaccinated people since the beginning of the pandemic. So what is the point of providing a vaccine certificate for non-essential businesses?
Okay, I think, I wasn't involved in this policy. It is provincial policy, but I think the point is that whether you're vaccinated or not, you should be able to access those essential services. Yeah. So in the emergency department where I work, we will never say to someone, you're unvaccinated, we will not treat you, for example. If you need to have food to eat, you should be able to go and get it. But to the question that we just had, that's why we still have those precautions and measures in place, because we know that they worked even before we had the vaccine. So keeping that distance, that's why when you go to the grocery store, you still have to keep that distance, wear that mask, don't come if you're sick. Yeah. Because there are still people who are unvaccinated who are accessing those services, and we don't want COVID to spread in those essential places either.
Right, exactly. And then, okay, a live question coming in here. Stephen asks, are we safe to go back to normal if you are around double vaccinated people?
So the vaccines work very, very good. I mean, these are very good vaccines, but we still know that even if you're double vaccinated, there is a small chance that you could get COVID. Now, your symptoms are going to be mild. I can say from the cases that I've investigated, there are mild symptoms. But every time even someone who's vaccinated gets COVID, there's a risk that they could spread it or that they could get more sick, right? So we still want to prevent as many infections as we can, even among double vaccinated. So that's why, especially those risky settings, those indoor settings, if it's crowded, please don't go. But if you have to be there, wear a mask, keep your distance, even when everyone is fully vaccinated.
Right, absolutely. Okay, let's go to, this is an anonymous question from our Cash. For now, booster shots are only being recommended for a small group of people. Do you think they will be recommended for the wider public? And if so, when should we all expect to get our third shot?
Yeah, that's a really good question, and something that I think is under a lot of, assessment among a lot of different groups. We've seen other countries make recommendations. In Ontario right now, our data is still looking good, that the vaccine is still showing that it's very effective, again, to prevent those severe infections. But it's something that's under close watch. We know that the 2 doses in most people give you that good protection that's lasting. The real question is there a point when that protection will wane? When now you're at, even if you were vaccinated, higher risk for getting very sick from COVID. And that's the point when, a third dose or a booster dose might be recommended. So, as with all things COVID, things can change week by week.
Yeah, which is why we talk every week, because it's always something new, for sure. In fact, something new this week that Jean is asking about. I heard that 5 to 11-year-olds are allowed to get the COVID vaccine now. Which vaccine has been authorized for use in kids of this age?
Actually, there is no vaccine authorized against COVID for 5 to 11-year-olds. Okay. Pfizer has submitted data to the FDA. I read that today in the news, though they haven't quite filed yet. They're completing their trials. But there is no licensed vaccine available for 5 to 11-year-olds just yet. We are expecting it sometime in the fall. That there could be one available. And so that's why there's planning going on to make sure that when it's available, we're ready to hit go and get the vaccine to our children.
Right, absolutely. And then they actually have a part 2 to their question. What kind of side effects could we expect to see in younger kids?
So from what I understand, and again, this is mostly from the media reports, I haven't seen any of the data firsthand, but that the side effects in children are similar to what you see in adults, less severe. It is a smaller dose in children.
Okay.
But this is all the kind of stuff that Health Canada is going to have to review before they can license the vaccine, and to be able to provide that information to parents as well.
Absolutely, right, for sure. Okay, let's go to Chuck's question. And this is our last vaccine question for now, but you can keep submitting live questions and we will take them. Let's take Chuck's question. How effective is the Johnson & Johnson vaccine? Is it recognized in Canada? And if I get it, will I need a booster dose even though this is a one-shot vaccine?
Okay, so it is a one-shot vaccine, not available in Canada, though I understand that there are many Canadians who may have gotten it when they went south, say, last year or earlier this year. It is, the efficacy is about 70% from what I've seen so far. And last week, the Advisory Committee on Immunization Practices, so the US equivalent to NACI, discussed boosters for Pfizer, and they made recommendations only for Pfizer because Pfizer has been licensed for boosters, but did talk about at that meeting that booster doses for other vaccines, including the Johnson & Johnson vaccine, will be likely.
Okay, okay. So even though it's a one-shot vaccine, you actually do have to get the second shot. Okay. All right, so let's go on to our non-vaccine related questions now. Margaret asks, I'm 73 and I called the dentist to book a cleaning. I asked if the hygienist was vaccinated and was told I was not allowed to ask and I would not be given the information. If I go to a hairdresser and wear a mask and do get an answer to that same question, why not the dentist, bearing in mind that you won't be wearing a mask or any sort of protection while you're sitting in a dentist chair?
Okay, so it's a good question. I think it's important to understand that vaccination status is personal health information, and personal health information is actually safeguarded. So, you know, and there are certain places in which you're required to disclose, like in a workplace that has a policy. I think the question that you could ask to the dentist is, do you have a vaccination policy for your staff? And what is it? Are they required to be vaccinated? If they're not vaccinated, do you have testing or some other thing that's in place? So I think that you could ask that. What is their policy for the workplace? You know, we've seen that our provincial government has put out directives for different healthcare services, different providers. And so, you know, I don't think that the requirements for vaccinations among some of these sectors is over. There could be more requirements coming. You know, again, with all things COVID, there may be more things coming. So there may be some changes in the future. It's hard to say right now. But in the meantime, what you want to make sure is that they are wearing proper PPE. And I think, you know, wearing, again, that medical mask or N95 mask, if there are aerosols with a face shield, that we know has worked to prevent the spread. And so you'll want to make sure that that for sure is in place as well.
Right, for sure, for sure. I guess you, like you said, it's personal information, so you can't particularly ask one person, but if you ask the business what their policy is, that might go some way in sort of reassuring you.
That's right, yeah.
And so, Doctor, on that note, actually, then Nick has a question saying, doesn't a COVID passport go against the doctor-patient confidentiality, or rather that, you know, like you said, the vaccine status is personal health information. Doesn't it contravene that then?
Well, you're actually providing it voluntarily. Like, you know, if you want to go to that business, it's required now. And so you are showing it. And by showing it, you're actually giving consent to share that health information. Right. Now, the reason why you're showing it and not giving it is because they are not storing it, because it's health information. So that's why you're just showing it. They're not keeping a record of it. Right. And then you are allowed entry.
Right, that makes sense. They're not actually, you know, storing your information. There's no privacy breaches there. That makes sense. Let's take Bailey's question. They ask, can you get rapid tested to go to a restaurant or a concert, etc.? I'm assuming instead of vaccination.
So that's not part of the vaccine certification program. I mean, you can certainly eat outdoors at a restaurant if you're not vaccinated. You can, outdoor venues also have some exclusions as well too. There is no rapid testing program provincially for that purpose as well.
Right. And Doctor, just to confirm, in terms of the certification program, it has to be both doses of the vaccine, right? Not just a single dose. A single dose won't get you in.
You have to be fully vaccinated. So it's not even 2 doses. It's 14 days after your second dose.
Okay.
Yeah. Now, if you had the Johnson & Johnson and that's a single dose vaccine series, then in that case, it could be just the 1 dose.
Right. Okay. 2 minutes left. Jackie asks, under what circumstances can a doctor provide me with a vaccine exemption? What criteria do you have to meet for that?
So it's actually very specific criteria. There are actually very few medical exemptions for COVID vaccines. In fact, I've been on some recent calls that, clinicians who have talked about people who had even an anaphylactic reaction to their first dose who can safely get the second dose. So I think whatever, if you had a very serious side effect, a very serious allergic reaction, you have to actually see a specialist to say that it's unsafe for you to get the vaccine. If you had myocarditis or pericarditis after the first dose, right now we don't have recommendations for the second dose. So that might be another medical exemption as well.
Right. Okay. And I'm going to squeeze in this last question from Ruby. Ruby asks, with a newborn in the house, what kind of precautions should we be taking? My husband and I are both vaccinated, double vaccinated. He works from home, but goes out for groceries and other essential things. Anything extra we should be doing to protect our infant?
Yeah, really good question. I mean, I think what you want to do is make sure anyone who has close contact with your infant is also vaccinated and taking precautions like wearing a mask, keeping a distance as much as possible, because infants will get COVID from other people. And so I think those are additional precautions you want to make. Going for groceries, again, that can be safely done, so taking precautions when you go for groceries, like please, you can continue to do that. Just continue to take your precautions doing that.
Right, absolutely. Okay, and then I think that brings us to our time. Yep, that's 1 o'clock. I was just making sure we didn't go over. So that's our time for today with the doctor. Thank you so much to everybody that submitted your questions and sent us a kind word. That was very nice. Thank you, doctor, for taking the time to answer all these questions. We will be back next week if we didn't get to your questions, but for now we'll sign out. Thanks, doctor.
Bye.